Hey, good afternoon, Facebook Live. This is Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining me today on the broadcast. Today, after I get done giving some information and answering some questions about the pandemic, about COVID, I have to be interested in some of the stuff that's going on from that end of things at the hospital. But before I get to Jim, I do want to start, and I will start talking about some things that I thought were interesting as I've been following the pandemic here in our county, state, country world. And yeah, as I start talking about these things, feel free to send out your questions so that I can answer those as well. I'll be glad to take care of those as we go through this. So, I thought I'd start with vaccine. That seems to be obviously a topic on folks' minds. So locally, we are here at the hospital. We are going to be vaccinating 400 folks tomorrow. We are still right now at the hospital. We're going oldest to youngest in terms of who we vaccinate, and we are still in the 86-year-old plus category in terms of those people that we're vaccinating. As far as upcoming weeks, we're still not sure how many vaccines we're going to have for next week to give. So it's still not a real smooth process yet. I know that the health department, state, federal folks are really working at this, but still right now it's in fits and starts. So I do know we're going to be giving 400 tomorrow. I don't know how many we would be giving next week. So here's on the national and state level. Here's what I do know. So the last I saw from the state level, I think I saw a little over 1 million vaccines have been given here in the state of Illinois, which, if I remember right, we have about 11 million people. So a little less than 10% of the folks in our state have received at least their first vaccine. Across the country, I'm hearing now that we've given 27 million doses, at least first doses across the country. The government is, right now, we're doing about 1.3 million vaccinations a day. And the president has increased what he thinks that we can do in terms of vaccinations in the first 100 days of his presidency from 100 million up to 150 million doses. So that's good. I was reading that Pfizer now thinks that they can get 200 million doses out for folks to have by May. I didn't read whether that was beginning or end of May, but that's a good sign in terms of Pfizer and what they're trying to do. I hear Moderna is trying to get FDA approval to have more dosages that they can do at one time in terms of their allocation. So that would increase the number of dosages that are available for folks. Here at, I know. So in terms of vaccines, in terms of effectiveness of vaccines, I thought this was really helpful to know. So of the five companies that have been doing those trials, I think it's AstraZeneca, Pfizer, Johnson & Johnson, Moderna, and I'm missing one. Anyhow, of those five companies that are doing those, about 75,000 people that have been in those phase 3 trials. Of those 75,000 people who they've been following for several months now who have received vaccines, there have been no deaths from COVID, which is really good. That's really successful. If you were to take 75,000 adults, just a representative sample of folks in our population who didn't have the vaccine, in those few months, we would anticipate 150 of them to die from COVID. So, big difference in terms of vaccinated and unvaccinated. Even if you were to take into account in a typical flu year, you would anticipate of a sample of 75,000 adults, between 5 and 15 of those would die from just from influenza. So the vaccine for right now, at least, the vaccine for COVID looks really promising. Now, granted, you're reading about, and I'm reading about and aware of, that there have been some mutations in the virus in different places throughout the world, and those mutations are making their way to the United States, and so there will be some issues with those mutations in terms of the vaccines and how effective they are. But I think the thing that I would say about that is, and this is the thing that I'm learning, and I just want to share with all of you who are watching, that as I read and watch experts talk about this, that as we define effectiveness of those shots and read about, so for instance, let's say the Pfizer vaccine, and that it's 95% effective. Now, that definition of effectiveness, 95%, is that essentially people just don't get it. It's 95% protective in terms of people getting COVID, symptomatic, feeling poorly, or some sort of symptom related to COVID. But there's a spectrum of what it means to be effective because, yeah, symptomatic COVID, we don't want folks to get that. But there's another effectiveness string of things, and you get all the way down to someone who gets severely ill or hospitalized. Um, like for instance, Johnson and Johnson's, which I think I saw 63% for effectiveness, but that's when they're talking about not getting sick at all. So far, at least with that product, like I'm alluding to with the 75,000 people who are in these trials that began this process, the ultimate goal is to prevent hospitalizations and deaths. And on that front, the Johnson and Johnson is at least right now way more effective than 63% in terms of preventing that. And if we can make if these vaccines make COVID more like the flu in terms of how many people get hospitalized or die, that's effective. That's another definition of effectiveness, but I see that as really effective, and and these vaccines are definitely trending in that direction. Now, the variants and the mutations will have some bearing on that, and that's why it's so important to get as many of folks vaccinated as soon as possible, because then that reduces the number of variants who can infect people, and then those variants can of course spread. So in the meantime, before vaccines are more readily available, I would encourage those of you who are listening to continue to do the masking and social distancing, because that right now is the most effective way we have to keep COVID at bay, and keep the number of variants that are spreading down. So please keep that in mind. A few other facts that I thought, at least this is more local and it's not a scientific study, but as of yesterday, we've had about 1,000 employees here at CGH who are now fully vaccinated, right around there. And as of yesterday, of those 1,000 employees, we had not had any of them who had a symptomatic COVID infection after they were completely vaccinated. So that's really encouraging. It gives us a more sense of how those vaccines are working. What else did I want to say about that? Oh, I thought this was interesting too. So, we've started to give vaccines, obviously, in nursing facilities. And as they've tracked the last 3 weeks in nursing facilities, as they've done these vaccines, the number of confirmed cases in nursing homes is really starting to go down a lot. And I think that's a sign of not just that the virus is waning down somewhat, but also that this vaccine is effective and really kicking in. So, just I'm saying all this because I'm just encourage folks that this vaccine, the benefits of it far outweigh the risks of the side effects, which there are. There are side effects in terms of people not feeling the greatest after this vaccine, for some people at least. But the benefits far outweigh those side effects and risks from my perspective. So, what else did I want to talk about in terms of COVID? I saw the latest information from the National Institutes of Health are for people who have had COVID. It looks promising that some of these folks who are now 8 months out from their infection still have evidence that they would have immunity from infection. So that's really encouraging. I do want to temper that with Matt, if you'd put up the latest numbers that we have. So you look at our county, 29.8, and if Matt, if you'll go down a little bit, our positivity rate 7.1%. Our county is running higher than the other Illinois counties listed there, a little bit lower than Clinton County in Iowa, but for Illinois, up in northern Illinois, we're running a little higher than those other places. And if Matt, if you're going a little bit farther, let's see here. Yeah, so we're definitely down. You can see our peak in November. Yeah, thanks, Matt. So we're definitely down from that peak. But if you compare to where we were at from March through, let's say, the beginning of September, we're still up. So we're still higher than we were several months ago. So doing better. I don't think it's a time right now to let our guard down as um, frustrating and difficult it is as it is to hear and say that. Until we can get more vaccines around, I think we just need to keep working at this at an individual level of being diligent with the things that we know are effective in terms of spreading infection, particularly with these variants that will become more part of the viruses in this area. It's really important because the reality is that we talk about COVID being a local thing, but it's really a global thing. So it's important for us to realize that getting vaccines into across the world to people into their arms is the way to go because this virus doesn't just stay in countries. It doesn't recognize boundaries of countries. It doesn't recognize that stuff. So it's a global issue that we need to keep thinking about in terms of this pandemic. What else did I want to mention? Oh, some other good news about this. And if you have any questions, please feel free to share those with me. I'd be glad to try my best to answer them. The the anti why is our county running higher? Yeah, good question, Mary. Um, I don't know that there are any easy answers for that. Um, I would say part of that might be how we go about trying to wear masks and distance. That maybe we're not as always on top of that as some other counties around us. There probably are more. There's more nuance to it than that, but I, I suspect that's playing into it. Um, Good question, though. Uh, Anyhow, these monoclonal antibodies, so the infusions that we are giving here at the hospital for folks who have symptomatic COVID and who are at high risk, we continue to give those infusions to patients. And I recently saw some research that was done. They just tracked 1,000 patients who had received these infusions. And of those 1,000 patients that have received these infusions, there is a 70% reduction in hospitalization for those patients. So that's really good. And there were no deaths in those 1,000 patients, which is outstanding. So, yeah, that's encouraging about these monoclonal antibody infusions. So, if you are in one of those high risk populations, and you have symptomatic COVID and you're within the first 10 days of your symptoms, you are a candidate for getting this infusion that we do here at the hospital. So keep that in mind and get a hold of your primary care physician if you're one of those folks. Uh, they've also changed on that. So it used to be an hour-long infusion. Now they're saying that we can do those infusions in half an hour, which is nice. It's a little quicker process for you. You still have to wait an hour afterwards. And I will temper that with the fact that it appears that some of these new mutations and variants don't the monoclonal antibodies don't work as well for them. So at least right now it seems to be working. I don't know in a month, 2 months, 3 months if they'll be working as well, but at least for now that's where we're at with that. Let's see what Christy wanted to ask us. Why can people go to Rock Island and just get the vaccine but not in Whiteside County? I have a couple friends under 60 that have. I cannot speak, Christy, to Rock Island because yeah, it's supposed to be 1B, and 1B doesn't fall into that bucket. Only thought would be there are other folks besides 65 and over who are essential workers who fit into the category that they also can get the vaccine. So I'm kind of wondering, I don't know for sure, Christy, if maybe your friends are folks who are might fit into the essential worker category. Otherwise, if they receive that vaccine and they're not one of those two categories, I'm with you. I'm not quite understanding that. Cheryl, do you have to get your vaccine from the county you reside in? I am Lee, but I am closer to Whiteside. Yeah, good question, Cheryl. I don't think so. I mean, for instance, if you're a patient at CGH and you're in a different county than Whiteside, but you come here to CGH, we have you in our database. We're sending out for those folks who are category 1B folks, we're sending out to you regardless of what your zip code is. So at least from a hospital standpoint, that's what we're doing. I can't speak to the county level, what our health departments are doing as far as that goes. So that there's a link on their websites that they may have more of that information for you about that. Good question. What other questions do the listeners have right now? Okay. One other thing, our results that I want to say on results standpoint here at the hospital, just some data about the number of tests we've done. We've done 18,375 tests. 3,158 have been positive, and 15,156 have been negative. So just some sense of the number of tests that have been done since this began. And obviously, the most sobering in our county is I looked a couple days ago. I thought we were at 138 deaths. Matt may have that information. If he does, he'll put it up there. If not, it was somewhere in that 135 to 140 range in terms of number of folks in Whiteside County who had passed away from COVID. So still very sober, and we still continue to have patients in the hospital. We still continue, unfortunately, to have folks who pass away from COVID here in our county. Okay, if you have more questions about COVID that pop up in your minds, please feel free to send those as we're. Oh, thanks, Matt. So let's see if we have. That's 138. Yeah, that's where we're at right now. So thank you. Okay, I want to transition now into environmental services. So I'm going to bring in Jim Du Bois. Hi, Jim.
Hi, doctor. How are you?
I'm good. Jim, I believe you're a Morrison guy, right?
Yes. Yep.
Okay. Well, not originally, I know,
No.
but he's right now he's a Morrison guy. So welcome, Jim.
Thank you.
I'm glad to have you on our broadcast. And I think folks are going to walk away from this with, yeah, they're gonna see that your department's it's a little sexier than they might think in terms of stuff that you guys do on a day-to-day basis. So first of all, what does EVS stand for?
EVS stands for Environmental Service Department. It changed about 10 years ago from the housekeeping department when the newer technologies came out and they started we started being able to disinfect the air, and clean the air.
Yeah.
Also getting more involved with the hazardous waste and things like that.
Yeah. Got it. So what would you say what's the role of EVS at CGH?
Our role at CGH for EVS is we clean and disinfect every inch of this facility, from public bathrooms, procedure rooms, patient rooms. We dust from ceiling to floors, disinfect everything. I mean, we don't leave anything unturned.
Yeah. Yeah, I
Daily.
know. Yeah. Hey, one other thing for our listeners too, I forgot to mention, we do have a field trip after Jim and I get done, so we'll have a little show and tell with some of the new equipment and stuff that Jim's team uses when Jim and I get done chatting. Jim, can you talk about the layers of cleaning that EVS uses to keep everybody safe here at the hospital?
Yeah, absolutely. One of the things that people misunderstand is that we always start with soap and water. That's our tried and true service. Um, Elbow grease, detail cleaning. Then we also use high level disinfectants, which is presently it's an accelerated hydrogen peroxide product with a 1 minute kill. So we have to leave that surface be wet for 1 minute. There's all kinds of disinfectants out there from 1 minute to 10 minutes. But the misconception out there is that if I wipe off a surface, then it's disinfected. If you look at the directions on your disinfectant, it'll tell you that that surface has to be wet for 1 to 10 minutes to kill everything that's on it. It will clean it, it'll move it around, but it won't clean it. Then we also have electrostatic sprayers that spray the disinfectant. Those units are relatively new to the industry. And we charge the particles that are coming out of that spray gun, and they're looking for the opposite. Do we charge it with a positive charge, and they're looking for the negative? So it wraps around products.
Yep.
And then ultimately, the highest level of disinfection is what people are hearing is ultraviolet rays. We've got one of the best. Well, we've got two of them on the market, and those go into at an average of 24 to 25 rooms a day. All of our procedure rooms get ultraviolet cleaned every day. All of our ED, every patient room that when a patient leaves gets UV'd. So
Yeah.
it's a group effort. It takes all those to keep the place clean and disinfected.
Yeah. And just for the folks who are listening, on our field trip, we'll show you some of this equipment, and I think it'll be interesting to see that for you. So, Jim, COVID, what unique challenges has COVID posed for you and your team? In the last 10 months, 11 months or so.
Well, mainly, I mean, we were pretty lucky. My staff was well trained before this hit. The biggest shock that we had in the system was that trying to get people to not necessarily believe everything they were seeing on the TV, getting our own staff to understand that. We'd have staff members coming in wound pretty tight after watching the news and things like that. And we'd have to talk them off the ledge and reassure them that they were in the safest environment, that we were giving them the safest PPE, personal protective equipment available, that we were using the top of the line disinfectants and things like that. So it didn't take us long to get our staff settled down. Now, every time we would implement a new face mask, maybe an N100 mask or something, that would wind up our employees a little bit, make them a little nervous. But once they realized that we were doing it because it was a better technology, then our staff would settle down very quickly. The other fallacy out there, and the public was afraid of the hospital,
Mm-hmm. Yep.
and I have to reassure people that, yeah, the hospital's got some sick people in it, but the environmental service staff and the nursing staff is doing the best job available. it's cleaner in these hospitals and these clinics than going out into a grocery store or anything like that. Our
Right.
people, you can't walk in the hospital without disinfecting your hands,
Yeah.
and getting your temperature taken. So, and wearing a mask 100% of the time. Our staff does it. I do it. So, once we got the community to understand that, hey, if I don't feel good, I need to go to the hospital, and it's safe at the hospital.
Mhm.
So that was one of the fallacies that, we had to endure during this
Yeah.
COVID influx of information. Some of it good information, some of it bad.
Yeah. I hope folks walk away from our conversation, Jim, with that understanding that, like, if you need to get out and about in public, there's probably not a safer spot to get out and about in public than within our hospital.
Right, right, exactly.
Yeah. Yeah. Okay. Want to talk about just briefly about for people who may have not been in the hospital and they don't haven't been sick or haven't needed to. We have really. I know this sounds a little detailed thing, but our floors are really shiny, and we'll show that in our field trip. But can you talk about that just a moment, Jim? What's going on to make it happen that way?
Well, I mean, I got to give credit to my floor guy. Todd Wiles is a very particular cleaner and waxer. But the floors are just as important as any aspect of the hospital, because what we're finding out through the industry is that people can track the germs from your shoes into your homes, so, I mean, we spend a lot of time daily. We auto scrub. First of all, we dust mop the floors, and then we have microfiber mops that our housekeepers or our environmental service techs go in and spot clean the floors. And then daily, Todd goes in with an auto scrubber, which is for lack of a better term, a 3M pad on a machine and with soap and water, and he scrubs the whole floor, every floor. And that also extracts. So it has a squeegee that's vacuuming up that water, and that soap and all the germs. Sometimes mops just move the
Hmm.
pathogens around into corners where somebody might step in it and then carry it in to a room or carry it into their car, and we want to prevent that.
Yeah.
So Todd waxes the floors at an average of once a year, and he also does, at an average of once a month. He goes in with a burnishing machine, and that's basically a real fine sander.
Okay.
Uh, it's a walk behind machine that he just lightly takes off the top level of that wax, and it really shines it up. Now, the other thing is that a lot of people don't understand is that we've got that little bit of carpeted areas that he takes care of also, and then we also have lots of floors that are no wax floors now, but we have to try to keep those as shiny as the wax floors,
Yeah.
and
Sure.
that opens up another whole issue. But he does a really good job at it, and it's a team effort. We have about three other people. Robert Coleman helps out. Um, I can't think of the other two right now, but they come and go.
Yeah.
That Rick Burge, he also does a lot of the scrubbing and polishing of the floors. So
Yeah.
it's all a credit to them. They
Yeah.
do a great job.
Yeah, they do a nice job, very much so. Hey, Jim, one other thing that crossed my mind is I'm guessing that we have some type of national. Um, this is how you're supposed to clean, and we have some sort of agency that we're following, and then even our folks. I'm guessing they've had some extra training along those lines. Can you speak to that?
Yeah. About 3 years ago, we were doing some research, and when we get inspected, people were wondering who trains our people, and we said, well, our long-term employees train our people, and that's a great way. That's the old tried and true process. But we also found the Association for our American Healthcare Association which has a national certification for environmental service people. And so we sent 5 of our people out for 3 days to get certified, which is a 3-year certification with a renewal every year after that. And these people got trained on basically anything and everything involved with environmental service, and also got involved with understanding the chain of infection and how to break that chain and where we can break that chain of infection. Because what we found out is that's the key to keeping people healthy, is that we need to break that chain of infection. There's 6 or 7 stages in that chain, and if we know where we're at, we can break that chain, and that pathogen is gone and not contagious at that point. These 5 staff members train our housekeepers, or our environmental service techs, excuse my language. They train them daily. They're our leads, and then we also offer a level 1 certification for our environmental service techs once they have been here 6 months. Part of understanding environmental service is just understanding the hospital. Where's the OR? Where's the emergency room? Where's the hazardous waste room? Because that's the other thing that lots of people don't understand with environmental service, or quote unquote housekeeping, is that we take care of all of the hazardous chemicals and all the hazardous waste in the hospital. The nurses fill these containers of all of the pathogens that they deal with daily. And then my people have to go and move that from procedure rooms to the waste container. And then we have to make sure that it's all certified and sent to the proper companies to dispose of it properly. So that national certification has really put us up on the chart. Not all hospitals get involved with that, but here at CGH, the management has found that that's going to be huge for us, and it makes our team holds us apart from other teams.
Yeah, and we'll talk to Maria Riggs in our field trip, and she speaks a little bit to that as well. She's one of our trainers, so yeah, good.
And these people have to take a 50, 75 question test, monitored test. So it's not just a typical adult education class where we assume that you're grasping it. They get tested. So and that was a lot of nerve-wracking moments for employees that we've got employees from 18 years old to 74 years old. Well,
you're not going to say you're 74 though, probably.
I'm not 74, but I've been out of high school for a day or two, and so education was a little shock to some of these people. But I'm proud to say that a lot of my older team members have taken the class and succeed, and we've got 100% of our people succeeded in the class so far.
Good. Jim, I'm pretty sure you didn't start out your career as an EVS person. I remember seeing you in a lot of other capacities, like at Westwood or those kind of things, doing stuff. So you've made a transition to EVS. What surprised you the most about managing EVS here and the team here at CGH?
Well, from going from a manufacturing supervisor for 23 years, and then Parks and Rec directors, and for about 8 to 10 years, and then coming into the hospital, wow, is all I can say. The details, that's the biggest thing that I've learned, is that environmental service is not just a janitorial service. It is details after detail after detail. When we interview people, we always push that, it is detail cleaning. There's nothing that can be left alone. One of my supervisors, Sonia Johnson, always likes to say, you clean that room disinfect that room like your favorite grandmother is going to be the next patient in there.
Mhm.
And we don't want anybody taking anything more home with them than they came in with. We want them to get help in here. And, but every person, sick patient that comes in the door has some other issue. And, if we're not detail cleaning, or documenting our paperwork and things like that, then we're leaving the door open for one of our patients to get something else.
Yeah.
So yeah, details. I mean, and the other thing about environmental services, we're involved with everything in this hospital. We're involved with not only cleaning, but emergency management situations. Every disaster, we have a part in that
Yep.
team. And lots of people think you're just a janitor. I beg to differ, and I'd be more than happy to let them walk a mile in our shoes to find
Yeah.
out that we are involved with, from OR to patient rooms. We're involved with cleaning public bathrooms and messes, everything.
Yeah. Like I
Environmental.
said, Jim, I hope folks walk away from from our conversation that they're hearing and get a sense that, yeah, this is not your grandmother's just mopping the floor type of situation. And I think they'll get a better sense of that if you take a look at our field trip that we did together with some of your team, because yeah, it's not that. It's a lot more than that. So, Jim, let's see here. I may be needing surgery in a couple of weeks. Is there any risks if I get the vaccine first? Okay. No, I think that'd be good. I think you'd be good to go to get your vaccine first. I think that'd be perfectly appropriate to do that. The only thing I would say is, if you're getting your vaccine like a day or two before the surgery, some people do have fevers and/or they don't feel real good for a day or so after their vaccine. So I would encourage you to get it probably at least 3 days, preferably more than that, before your surgery. There was another question that popped up. Why do grocery stores not mandate mask wearing? You can go out to our Walmart and there's so many shoppers not wearing a mask. Yeah, Mary, that's a good question. I think they do. I think they do say you need to wear one. Gosh, it must be so hard to be in their position to try to be the enforcer for everyone who doesn't choose to wear a mask. And I know that, yeah, I don't envy their position. So yeah, it would be nice if people would see a sign and just do that. Yeah, I think, Mary, you may have asked, why is our county number a little higher than other counties? Okay, that may be a little bit part of it, because I think you go other places. I have kids that live in Chicago, and at least what they tell me, when you go into those kind of places, it's like you're wearing a mask. So I think there is a little bit more of a, yeah, you should wear them, but not quite as stringent as you would in other places.
And I wonder if it's not just also related to the proximity of us to Iowa.
You wonder.
Have a different,
Different mentality.
yes.
Yeah. Yeah. Good question, though. I appreciate that, Mary. Hey, Jim, thanks a lot for your time. Appreciate you chatting with me for a few minutes. Jim and I are going to step away, and in just a minute here, we'll put up our field trip for the EVS services, and I think you'll enjoy this. So, hey, thanks again for everyone for listening, and Jim, thanks again for being on with me.
Yep, no problem.
All right, take care. Okay, welcome to our field trip. Hi, everybody.
Hello.
Hello.
So I already saw you on the Facebook Live, Jim.
Oh, yeah.
Yeah, now they see how much bigger you are than me instead of just on the screen, right? So, hey, I have Sonia here with me as well. Hi, Sonia.
Hello.
Sonia is a supervisor here with EVS, correct?
Correct.
You've been doing that for a few years.
I've been doing that for, a few years.
Yeah, well, we're not going to go into details. What's a few years between friends, right?
Exactly.
All right. So I thought it'd be, I hear that Sonia is the Xanax expert. So,
Try to be.
yeah, that's right. So this little baby here is one of our pieces of equipment that helps to keep things clean. You want to talk about it a little bit, Sonia?
Yep. We have two Xenex, ultraviolet units, Zippy and Gus. We lovingly refer to them.
And this one is,
This one's Zippy.
oh, this is Zippy.
This is Zippy.
Oh, I kind of like that name. Yeah.
So we use these on almost every discharge. After we've cleaned and disinfected the room, we bring our robots in and do 3 5-minute cycles.
Okay.
2 near the bed and 1 in the bathroom.
Okay.
And we do that on pretty much every discharge. We do zap the ORs every day. We zap our DHC rooms
So
every day.
DHC is where you have like colonoscopy and
Yes,
stuff. Yep.
because they're supposed to be really good for C. diff. They're bacteria and virus
C.
killers.
diff is the kind of infection you get in your colon.
Yep.
So, yep.
And that's kind of why we started getting these.
Yep.
And we've had them since 2015.
Yeah.
And we do the ED rooms, try to do those every day. C-section room after that's been used.
Yeah.
A
So-
lot of the
Yeah.
cancer infusion rooms, we
Yeah.
do them in to keep those rooms as clean as possible.
Sure. So basically, about any patient area here
Yeah.
at the hospital, this thing's getting used.
Yeah, they're
Pretty
like the
much every
frosting
day.
on the cake.
Yeah.
That's
Yeah.
for sure.
Okay. Well, I thought it'd be interesting for folks just to kind of see how you set it up, and also
Okay.
just kind of we can look outside the door here and kind of see it doing its thing. I thought that'd be kind of interesting to see.
That
So
would be great.
I hear that we have to shut the blinds at nighttime with these because they're bright enough that the
They're very
neighbors.
bright, and the neighbors will call and ask what's going on.
Yeah. Okay.
That's for sure.
Yeah. So I mean they're the
Yeah,
real deal. And
all right.
and I
I'm gonna
asked
get it
you,
set
and I
up.
was just curious about one other thing. These kind of have a strobe effect. Is that right?
Yes.
Okay. So like like when you went skating and you had the moonlight dance and they had the strobe light thing. Did you ever do that, Sonia?
Yeah.
Okay.
Maybe
so
you did that. Maybe skating.
all right. So does this kind of have that feel to it?
You're not supposed to look at it, so I wouldn't know.
Oh, okay. She doesn't know. But if you were to look at it,
It's it pulsates.
never walked by the room and kind of did the slow walk just to see. No.
You can, but it'll hurt your eyes.
Okay, never mind. We wouldn't
So
do
don't
that.
do
No.
it.
Okay. All right. So
Yeah.
Sonia, let's go in here. We'll get it all set up.
We average about 25 rooms a day. The industry standard for this is about 10 rooms a day.
Okay.
So
Okay.
we're far and above what other hospitals use their
Okay.
Xenexes, and our staff has always said, hey, as long as we got these
Yeah.
high level disinfecting machines, let's use them.
Yeah, for sure.
Some places end up putting them in closets, and
No, I see these all the time when I'm walking around.
Yeah.
So you guys are really good about that.
yeah.
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 Okay. So Sonia's firing up the machine. Let's go take a look here.
So she's put her program, her password in there.
Okay. So
And then just doing a test,
Okay.
so it knows we're not really doing anything.
yeah.
It is testing.
And so just to clarify, so you would do typically you do 5 minutes on that side of the bed.
Yep, and all the
5
rails
minutes
would
on
be
this
up,
side
the
of the
bed
bed.
would not be made.
Okay. And the bed. And why is the bed not made?
So it'll get the mattress, the handrails are up, this part is up, anything that somebody would touch
Yeah.
is what we're gonna.
Because my understanding is it can't get into the dark places, so it has to be a spot that's
It has to
exposed.
be up, it has to be open, it's not gonna go through glass, it's not gonna go through curtains,
Yeah.
it's just gonna get the surface.
Yeah, and then you're gonna hit 5 minutes in the bathroom.
And then 5 minutes in the back.
Okay, all right, yeah, so really
Yeah.
high touch kind of place.
Yep, exactly.
Great, okay,
So we're gonna continue, push the green button and we're getting out of here.
okay, so let's get out. It's about to do its thing here. Oh, I better turn this light off. Okay. All right.
We do set up a motion sensor cone, so if somebody does actually accidentally
Yeah,
try and open the door, it'll automatically shut down and the light just,
okay, I'm
Goes
hearing them
down.
starting to beat faster, so I think
Yep.
it's about ready to do its
you
thing.
can hear them.
So Dana, when you put the camera in there, close your eyes though when you're doing that. All right, I think we're about ready to go here.
They talk to you and tell you what they're doing.
So that's kind of that's the routine there with what the folks are seeing on that
Yep. Yep, it
video.
goes up. It'll go for 5 minutes on each side. It takes about 90 seconds for it to, once you hit the green button, to flash.
Okay.
To go up, and gives you time to get out, open your
Yeah.
Purell container. So, because this will set off Purell, and you'll end up with a a load of
So
Purell.
in other words, the thing where you swipe your hand underneath there and you get a little bit of, you have a big old.
Yep, the noise or the pulsating, whatever it is in the light will set that motion sensor off,
Okay.
and you'll get a
puddle.
a puddle.
A puddle of Purell. Say that fast.
Yeah, no. So
All
it
right.
gives you enough time to get out of the room, get it set up, get the phone set up, and
Good.
and it'll go for 5 minutes.
Hey, thanks for the update on our Xenex.
We love them.
You know it. Okay. Thanks, Sonia.
Thank you.
I have Maria Riggs with me. Hi,
Hi,
Maria.
Dr.
Hi.
Happy day after your birthday.
Thank you.
Did you have a good birthday?
Yes, I did.
Anything special you did for your birthday?
No,
Okay.
no, just relax.
Okay. Well, that's good. It's good to relax
Yes,
on
it
your
is.
birthday and celebrate the fact that you're around for another revolution of the.
That's right.
That's right. That's good. That's good. So, but we're going to talk a little bit today
Okay.
about the work that you do to kind of keep rooms, not just kind of, but to keep rooms clean
Right.
so they're safe for our patients. And you've been doing this for a while. How long have you been working here at the hospital?
26 years?
Yeah. So Maria was here, you were here when I started here.
Yes.
Yeah. You remember me when I was
Yes.
young? My hair there was no gray in it.
Neither was mine, so we're in the same boat.
Yeah, there you go. There you go.
Yes.
All right, and I'm pretty sure that you have some extra certification or work that you've done
Yes.
in over the years to make sure that you know what you're doing and to
Yes.
train other folks. Do you want to talk about that a little bit?
Okay, a couple of years ago, we went to Salt Lake City, 3 of us from our department, and that was a very good educational, and we learned the cleaning, disinfecting, and how important it is. And when I was there, they asked how many people use Oxivir, and only a few people rose their hands. It was about 60 people in our
This
class.
is Oxivir, is that right?
Yes.
Yeah. Okay. Those wipes that you hear about quite a bit nowadays. Yeah.
And there was about 60 people in our class, and only a handful of people ever heard of them. And so we were using them before we went there.
Yeah.
Okay. And so then they asked us about the robot, and 6 of us rose our hand, and 3 of the people were from CGH. So we were ahead
Yeah.
to kill infections and different things
Yeah, that's
with
good.
the robots.
Yeah.
And so they were very impressed that a small hospital
Yeah.
had a robot.
Yeah.
And we told them we had 2. We were like
We
a
don't mess
third one.
around. We don't do one. We
No.
have 2.
Yes.
All
We
right.
wish we had another one, but we're blessed to have 2.
Yeah, I hear you. I hear you. So, okay, so Maria, what I thought we would do is kind of go in here, and I wanted to hear about how you go about cleaning if someone's in the room, and then
Okay.
also I want to hear about what you do once someone has been discharged and you
Okay.
kind of turn the room over for the
Okay.
next person who's coming
Okay,
in.
that sounds real good. But before we go, I'd like
Okay.
to show you these cards.
Okay.
These are new since Jim's been here, and these are from Italy, and they lock
Ooh,
up.
Italian
Yes,
cards. Wow.
Yes, they're
Like
very
race
nice
card
cards.
kind of things?
Yes,
or-
they're
okay.
very, very nice,
Okay.
and they lock up. We keep this for our trash, and right here we keep our chemicals.
Okay.
And down here we have like bags, and we have these yellow cloths that we keep the bleach off,
Yeah.
and then the next one we have paper products.
Yeah, and I know, I'm sorry to interrupt, Maria,
I'm
but I
sorry.
think these are kind of interesting too. And
Yes.
the old ones, everything was kind of sitting out, and you
Yes.
could, and these are
And they were
pretty well.
noisy,
Yeah,
and patients don't like noisy stuff.
Yeah.
So these are nice.
Yeah, so they're pretty self-contained, and when you're not around them,
We lock 'em up.
You can lock them up.
Yes, and they like that we
Yeah.
lock things up.
Yeah, I mean that's a really
Important thing.
yeah.
And so here's all our lots of things in
Okay.
for bags and towels, and down here we have more paper products,
Yeah.
and so on. And up here we have our chemicals.
Yep.
And let me show you the 2 chemicals that we use a lot.
Okay.
Because these are important when we clean our patient rooms. Okay, this is the Oxivir.
Yeah.
Yes, so this is very important. This is a 1-minute kill.
Yeah.
Okay.
So it just takes 1 minute. 1 minute,
Yes.
and it's
Yes.
and whatever's around, it's dead.
Yes,
Nice.
yes, we use this quite often.
Yeah.
That's an accelerated hydrogen peroxide product.
Okay. All right. And what else do we have here?
And this is our bleach. And this,
Ah.
we use it in the bathrooms.
Okay.
And so this is a very good product too. And this is a 3-minute kill.
Okay, so it takes 3 minutes.
Right.
All right.
And so by the time we get the room all mopped and
Yeah.
working our way out, that's about 3 minutes.
Yeah.
And so we can use that.
Nice.
Yeah. So it's a very nice product. And
Yeah.
Part of these carts speeding these carts up with what we call an equidose system. So trying to get each mop uniformly wet.
Ah.
In the olden days,
Yes.
Maria would wet a
buckets.
floor differently than I would wet a floor, so
Okay.
it took longer to dry.
Okay.
Now
Right.
we can set the gauge on it and just push down the button, and it puts out the same amount of fluid every time
Every
for
time.
each one of
And
us.
the floors run
Nice.
pretty fast.
Yeah. Okay.
And we use one mop per patient room.
Okay.
And sometimes we have to use more, we'll use more.
Yeah.
But in the olden days, we had buckets and mops but this is much, much better.
Yeah. That makes a lot of sense.
Oh, yes.
I remember the kind of thing where you have the squeegee
Yes,
thing where
yes.
you pull it and
Yes, and now, this is good for us to kill infection because we don't want to take infection from one room to another. So this is very nice.
yeah, that's a nice feature.
It sure is.
Thank goodness for those Italians, huh?
Yes.
All right.
But I'm glad we have these cards. They're much, much better.
All right, so Maria, stay close to my mic, but
Okay.
let's kind of begin walking through. Like
Okay.
as you walk into, let's say a patient's in this room.
Okay,
So what would you be doing here as you kind of walk
Hello?
through?
EBS, it's Maria. Can I go ahead and clean your room?
Yes, you
And-
can. Yes,
Thank
you
you.
can. Okay.
Then I would go on. I would sanitize my hands and
All right.
put my gloves on, and I would get a wipe, and I would start with the oxybeer. I would start wiping all the high touch areas,
Okay.
all of them. And when we come into the patient room, I would ask, "Can I go ahead and wipe your table?" And
Okay.
lots of them they say yes, and some say no.
Yeah.
And I would like to wipe their call light because that's high
Sure.
touched, and then the IV pole, I would like to wipe the front of it because it's high touch. So anything high touch, I would like to wipe.
Sure.
And so I always start like from here, working my way, because that's how I was taught in my class. You go one direction,
So it's,
and
yeah, pretty systematic. So
Yes.
that way it's like you're not jumping back and forth.
right, and that way you don't forget anything.
Yeah, yeah.
And so that works very, very well. And the bathroom, we always clean it with the bleach, and then after 3 minutes, we take all the bleach off.
Okay. Yeah.
And it looks very nice and pretty when you do that.
Yeah, yeah,
Yes. And then when we do a discharge,
yeah.
the CNAs are pretty good about stripping our beds for us.
Good.
And so we come in, we go ahead and pick up all the linen,
Mhm.
trash, and we take it to where it belongs. And then we come in, and as I'm walking this way, I turn on my shower, and I like to let it run.
Let me ask you about that. You said you just turn on the shower.
Yes.
You like to hear water run while you're working,
No,
or?
I like to let it, the drain, because sometimes you can smell gases.
Yeah.
If we don't use the showers enough.
Yeah.
And so I like to let it flush out,
Yeah.
and I do, clean them with bleach off the whole wall.
Yeah.
The whole shower, I clean it with bleach.
Yeah. I remember Jim was saying something too. The reason we let the water run. Can you kind of speak to that a little bit, Jim?
Well, rooms that don't get used very often, and sometimes showers don't get used in
Right.
the hospital because patients
Yeah.
aren't able to get into them.
Yeah.
Can build legionnaires. So we, as a proactive to prevent
Yeah.
legionnaires, every housekeeper runs the shower and the sink during their 30 to 40, 50-minute discharge
Yes.
to get the fresh water through the system. So
Yeah. Yeah.
other places you probably heard over the years that they
Yeah.
had legionnaire
Yeah.
contaminations.
Yes.
So that was one of our processes that
Yes,
we
that helps a lot.
Yeah. That makes a lot of
helps
sense. That
Yes,
you
it
kind
does.
of. Yeah. I get
Yes.
that because you'd think that people would use the showers and stuff, but there are some really sick people
Right,
that are
that
not
they
able to
cannot.
do it a whole
No.
lot. Yeah.
No.
That makes sense. Okay, so anyway, I interrupted you and you were
I'm sorry.
talking about
I'm sorry.
when someone's discharged and.
Okay, so then after I get all the things out of here, like I said, I run the shower and then I start all the high touched areas. I wipe them. And I'm working the same direction. And then the last thing I do is I do the bed. And the bed, I raise it up and I go ahead and clean it with Providence.
Yep.
And then I like to do the mattress with that because it's detergent and it's wetter.
Mhm.
And we use these cloths.
Okay.
And I wash it really good.
Yep.
And then after a little bit, when I'm done with the bottom, I go ahead and wipe it with the oxybeer.
Okay.
So, and that, kills everything.
Yep.
Yes.
Yeah.
And so by that time, we come and we mop.
Yeah.
And we get the robot and we put it 5 minutes there, 5 minutes here, and 5 minutes in the bath.
Yeah.
And so, it's a process. And
Yeah.
then, we get it all ready and all prettied up for the next patient.
Yeah.
I like to check my my walls, windows, anything, and make it nice and pretty for the next patient.
Yeah, I'm curious. How about the ceiling? Anything with the ceiling that's between patients or?
Well, the ceilings, I high dust them all. I
Okay.
high dust them all.
Okay.
And then every month, we're on a schedule now that we have to wash walls.
Okay.
And right now, we're washing walls, we're washing the ceilings. I get up there and I wash the lights, the vents. So we're in a system now. Every month, we have to do those.
Okay. Do you do anything different with COVID patients in terms of that kind of stuff?
Well, with the COVID, you had to take curtains down too.
Okay.
And we really should be washing the walls,
Mhm.
everything, wash everything.
Okay. Yeah. So it's just another even
Oh, yeah,
beyond what you're already doing,
yeah.
which is quite a
It's
bit.
more.
Yeah.
It's
okay.
more because you have to be very careful, wash
Yeah.
everything.
Yeah. And you all have been going into the patients who have
Yes.
COVID into
Yes.
the rooms. What's that experience been like?
I was there Monday and it was just, for me, wearing all that gear,
Yeah.
and I just feel like these poor patients, I would love to talk to them,
Yeah.
but I couldn't talk
It's
to
hard
them.
to kind of get a lot
Yes,
of
yes,
good communication.
right. I had one patient tell me, she says, I'm sorry you had to wear all that gear. And I said, that's okay,
Yeah.
And she was happy to, for me to come and visit with her.
Yeah.
And I did the best I could,
Yeah, I know
because
you
we
did.
had all that gear on.
Yeah. Maria's really good about having conversations with our patients to the extent that they're able to when you're in the room kind of
Right.
doing your cleaning.
Right.
Yeah.
I did appreciate that I was able to do that with her,
Yeah.
because it was just so lonely to be there by yourself.
Yeah. But you're good about it. I mean, even folks that aren't COVID, I know,
Right.
I hear you talking with them when I walk past the rooms.
Yes. Yes, because it's so lonely being here at the hospital, and especially times that, we have all these restrictions that, people cannot come to see you.
Yeah.
It's nice to have somebody to talk to because I know we're all busy.
Yeah.
But just take a few minutes and visit with those patients.
Yeah. Maria's really good about that. by the way.
Well, thank you.
Yeah. Maria, thank you so much.
Thank you,
really,
Doctor.
really appreciate it. Was good talking with you, but also appreciate the work that you do and the
Well,
rest
thank
of your
you.
team as well.
Well, thank you very much.
Okay, so next step on our field trip to kind of talk about the level of disinfection that we're performing here at the hospital. This is really interesting stuff that Jim's going to talk to us about. So what do we have that we're looking at here, Jim?
One of the newer technologies out on the market is an electrostatic sprayer. It's a sprayer that takes the liquid and makes it a positive charge, so that it's looking for a negative piece of equipment, so that we got opposites attracting it, and it will wrap around. The chemicals will wrap around the surface. It's hard to clean sofas and chairs in lobbies and things like that. So the electrostatic sprayers came out. We've got a number of different chemicals that we put through our electrostatic sprayers. The best one is a 2-minute kill. So during the second and third shift, our staff goes around and we spray all of the public areas. Public areas being lobbies, public bathrooms, front door entrances,
Yeah.
things that are usually full of people. So
Yeah.
during the day.
They
So
get at least some traffic during the day of different folks.
Right,
Yeah.
right. So
Dude, I'm just curious, Jim, this is really interesting technology. Is it used elsewhere besides hospitals?
yeah, the electrostatic spraying technology actually came from car painting business, and also field work. They use sprayers out in the fields. They aim this towards like grade schools, things like that.
Do they like, how about an airline? Do they use it on an airline?
Airlines, they do all the inside of the airplanes now. They
Okay.
do the steps. And actually, when COVID first started, you might have seen it on TV where they were actually literally spraying people as they were coming off the. I mean, it is safe. That's the nice thing, the
Yeah.
disinfectant.
Yeah.
To a certain extent.
Yeah.
We would never spray people, even though,
You may want to.
you may want, I may want to, but it's just something that it's not meant for that. It's meant for the furniture, the carpeting, stuff
Yeah.
like that.
Yeah.
Ceilings, we can hit the ceilings.
Yeah.
You pointed when Maria talked about cleaning the ceilings.
Yeah.
That's what we do when we high dust it. Then we come in on third shift, and it's just like we're spray painting a house.
Oh, wow.
Okay.
Okay.
And it's very quick.
How do you know if you've hit it? How do you know if you've sprayed it?
Well, you can tell by the spray when we take an example. We also could bring a black light in here and turn off all the lights and see where the blue surface is.
Yeah.
And the test results show that it actually wraps 360.
Yeah.
The Clorox machine does. The other ones, the battery operated machines don't. They have a little bit bigger particles, so they don't get 360. They get about 300 degrees.
Yeah.
So anywhere where a patient or an employee would touch is getting hit with these things.
So you can light it up and just see how well you've done with it.
Yeah.
Like I remember when you're a kid, you get that little thing when you brush your teeth and you had to swallow. You
Exactly.
chew on that pill and it would.
Yep. You could smile and all your teeth were black or blue. Yeah, exactly.
That's the concept.
Yep.
All right. Well, I tell you what. You want to demonstrate this?
This is a Cadillac of them. Basically, you just aim and squeeze, and you can see that it's not dripping or anything, and that's a part of the electrostatic spraying. And I'm not having to get down underneath anything. I can spray the phone, I can spray computers, I can spray the windows, and you don't have dripping going on.
Yeah.
And this chemical has a 2-minute kill time, meaning that surface needs to be wet for 2 minutes to kill all of the stuff.
And Dan is showing us that you really wouldn't know as you're looking at that surface that it's been sprayed.
Right. But if you run your hand across it, you can feel that it's a little damp.
Yeah.
But within 2 minutes, it'll be dry and we've killed all the surface.
Yeah.
Now, our housekeepers are in here dusting this and wiping it off. So it's not a magic tool.
Yeah.
The whole cleaning process it works together.
Yeah.
You soap and water, you disinfect with these, you dust, everything, and then you UV. Everything works together.
Yeah.
But these are really nice tools.
And these are, I feel like this is like Ghostbusters kind of stuff.
That's right. That one has a backpack. You put it on your backpack, and you can hit like stairwells that don't have electric cords.
Sure.
So all those handrails and stairwells that we all know are full of stuff that people have touched. We can use and
very nice.
We could take these into like construction areas where we've taken the drywall out.
Yeah.
And if there's mold or something in there, we've got another chemical there that will kill all the mold on those 2x4s.
Yeah.
And then we can measure it before we put the construction zone back together.
Yeah, very slick. Very nice stuff. I'm sure this is a pretty cheap piece of equipment. Right?
Yeah, this is the top of the line. They run $3,000, $4,000, $5,000, all the way down to $300.
Yeah.
So it's a tool that, and just like the UV, it's a tool that you spend money on. You want to use it.
Yep.
You don't want to leave it in the closet.
Yep. You guys do a great job with that. Yeah. You guys are out and about and using these all the time. So that's great.
Yeah. And our staff really likes this, especially the nighttime, because the furniture is hard. The cloth furniture is hard. I mean, we buy the best, easiest to clean, but to get into those cracks and crevices, it's hard.
Yep.
So
this really gives us more protection.
Good.
Exactly.
Good.
Thanks, Jim.
Yep, no problem.
I thought this was a great hallway to show you how nice our floors look. And show that hallway to folks if you would, Dana. See how nice and shiny those are? So Jim, can you talk a little bit about that and how we get those so shiny?
Yeah, that's a team effort. We have a floor supervisor lead, and he takes a lot of pride in his quality. Yeah. Every day they dust mop it, of course, and then they auto scrub it. They have a Zamboni that they run it through here every 4 or 5 o'clock at night. Once a week they'll burnish it with it's kind of like a sanding pad, so that it'll shine it up, and then at least once a year they come in and strip and wax the whole floor. During COVID, we haven't been able to do that because we've been a little bit busy with other things. So you can tell that when he's done this floor the last time, it lasts a lot longer than we actually need it. I'm trying to think. It's Todd and Robert, or Todd Wiles is our lead. Robert's our nighttime supervisor. He helps with that. And also Rick Burge is on our third shift, and the 3 of them take care of all of our floors for us.
It's almost worth coming here to the hospital. Just look at the floors.
There you go. I'm with you.
Okay. Okay, so I'm here. We're still going on our field trip, and I'm here with Dan. Hi, Dan.
Hi, how you doing?
I'm doing good. So Dan is part of our team that moves stuff around here at the hospital.
Yeah, I always run the garbage, run boxes, and
Yeah.
needle box calls. I go get them when I get
Yeah.
calls, and
Yeah.
it's always a fast moving job all the time.
Yeah, yeah,
Keep up with all the rooms.
yeah.
Push the OR and-
Between Dan and Tom and Jordan, you see these guys all over the place, and I don't. How much cardboard or how much trash do you think we go through
We
in a
probably
week?
go, it's 1,000 pounds a day. I bet we probably about 2 or 3 tons
A week?
a week, maybe 2 tons.
Okay. Yeah. So it's really. I mean, that's just how it is. A hospital, there's a lot of stuff that goes in boxes.
12
and-
loads, and we used to weigh it, always weighed between 90 and 100 pounds when we used to weigh it, so I'm doing at least 10 or 12 loads a day easily.
That's a lot of weight you're lifting. In
Yeah. And boxes, we probably make about 4 bells a week, so they're supposed to be 700 pounds
Okay.
on the average, so.
All right. Now I know Dan's a big music fan. When you're moving
Yeah.
stuff around here, do you have any music that you sing to yourself?
I don't sing it in my head, I do. I'm singing out loud, but I like to listen. I think of music all the time.
We always talk about the
Yeah.
concerts that you've been to.
Yeah, I've been to quite a few of them.
Yeah. Not so many in the last 10 months though.
So, let's put a damper on it this
Yeah.
year.
Yeah.
Last year.
Well, hopefully here in the next few months you can get back to some concerts. Huh?
Yeah, I would
Yeah.
like that.
And so Dan, one other thing I just want to ask you about before I let you go, get about your work today. How much of this stuff? How do we recycle any of this, or how does that
Yeah,
work
we
out?
got these white recycling bags. We got a special green bin. We put it out back there by the dock, and then when it gets full, we take it outside. We have a special bin. We throw it in a recycling bin out there, and they come
Okay.
and pick it up once a week.
Okay, good. Well, that's good to hear. And then how about
Yeah.
the cardboard? What goes on with
And the
that?
cardboard, we just throw in the baler, and we just, when we get it filled, but usually every other day, sometimes every day, then we, they come and pick it up and take it out to self-help. We
Okay.
usually go through four bales a week,
Okay.
or
How much
about
is it?
700 pounds a piece.
Oh wow. Okay, so you're talking 2,800 pounds
Yeah.
of cardboard.
Yeah,
Wow, that's a lot that gets recycled out there at self-help then.
yeah, it is.
Yeah. Okay, good. That's good to know. All right. Hey, Dan, thanks a lot. Appreciate it.
You're welcome. Pleasure talking.
Yeah. Okay. Well, this is the end of our field trip, Jim. We've done a
It was
pretty.
fun.
You guys have kind of. I hope folks get a sense that there's a lot of stuff going on. There's a lot of. Yes, there's a lot of. Nothing takes away when you just old elbow grease and rubbing stuff down, but you guys do have a lot of stuff going on besides that.
Absolutely, and a lot of our stuff is employee pride. You know, it's hard work. We've got great technology and stuff with us, but our employees take a lot of pride.
Yeah.
I don't, Maria always brings it up. I clean a room like my favorite grandmother is going to be in there.
Yep.
And that's the message that we preach to all of our new employees. And it's teamwork. The nursing staff helps us out when they can. With this COVID, we've known that everybody's been a little overwhelmed.
Yeah.
And so everybody's been pitching in.
Yeah.
From nursing to POMs to everybody.
Yeah.
So
Yeah.
it's been a great, and we were lucky. It didn't surprise us. We had already had the Oxivir. We already had UV. So the biggest fear that we had was getting our people to stay calm because they were watching the news and stuff.
Yeah.
And that only took us about a week or two to settle our employees down.
Yep.
To realize that this is one of the cleanest places in the
county.
community. Yeah, in the county, So people started coming in. So.
Yeah. Good. Good. Hey, thanks a lot, Jim.
Yep.
Appreciate it again.
No problem. Thank you.